Hello, my name is Guilherme Castela, and I'm the corresponding author of our article and treatment of advanced retinoblastoma in children from low-income countries experienced from a national reference center in Portugal. Just to give you an insight in our article, our objective was to study and characterize the evacuated African patients diagnosed with retinoblastoma and referred to the Portuguese National Reference Center, our center, Centro Hospital Universit&aacute Coimbra, in University in Coimbra in Portugal. We aim also to identify inequalities in the stage of diagnosis and the prognostic results. We designed a retrospective observational study of all evacuated African patients diagnosed with retinoblastoma and refers to our center. The study included 15 patients between October 2015 and October 2020 from Angola, Cabo Verde, Guinea-Bissau, São Tomé e Príncipe. 7 presented with bilateral retinoblastoma. The median age at diagnosis was 20.9 months. The presenting signs were leukocoria in the majority of patients, 86.7, strabism, 53.3, and ophthalmos, 40%, and a high percentage of these atypical presentations. In terms of tumor staging, 5 children presented with extraocular disease, and 10 children presented with intraocular retinoblastoma. At presentation, pineal involvement was diagnosed, but 2 children presented no pineal involvement was diagnosed at entrance, but 2 children presented with central nervous system involvement at the time of observation. All children were treated with or enucleation or concentration, systemic chemotherapy, and intraarterial chemotherapy, and also supportive palliative care. During the follow-up period, the overall survival was 73.3%. In conclusion, we know that a small proportion of African children are being referred to our center. Perhaps the only ones that can be evacuated are we receive, the others we don't receive. When considering the expected incidence of retinoblastoma in these countries, we think that the number will be higher. Also, we can conclude that children are referred in more advanced stages, that we have patients with a lot of extraocular presentations, which compromise treatment outcomes. Considering retinoblastoma is nowadays a curable disease, obviously national and international interventions are required to attempt for an early diagnosis, an early transfer to the reference centers, so the children can have better results for the treatment. Thank you.